Hello, everyone, and welcome to our new show. This show is called The Exam Room with Nurse Alice here on blackdoctor.org. I'm Alice Benjamin, clinical nurse specialist, family nurse practitioner, and media health expert. And this is a show that will be happening every week, every Monday, 6 p.m., 9 p.m. Eastern Standard Time. And it's a show where we're going to do a deep dive and get into take a closer look to important issues. And so for this week, there's so many things going on in the world today, but one of the number one things on everyone's mind is it safe for kids to go back to school? And so for this episode, I invited two of the best trained experts that I could think of who could comment on this topic. And you can see them on the screen there. They are some of my best friends and colleagues there. We have Dr. Sherri and Dr. Jarret, who's joining us this evening. And so first I'd like to introduce you. If you may not know, this is Dr. Sherri Broadwater, who is the co-founder along with her husband of Healing for All, a psychiatric and coaching wellness center in Atlanta, Georgia. And Dr. Sherri provides psychiatric care and family coaching to high-performing families caught in the cycle of problematic communication, frustration, and maladaptive functioning. She is also, at the Women's Health section, the chairman for the National Medical Association. And Dr. Sherri is also faculty at Morehouse School of Medicine. Thank you for coming to the show, Dr. Sherri.
Thank you for having me, Nurse Alice.
All right, wonderful. And then also who we have on the show this evening is we have Dr. Jarret Patton. And now Dr. Jarret, he's a pediatrician, he's a father, he's an author, he's a speaker. And actually, I've read his books. I have them here. Dr. Jarret is awesome. Again, he is a pediatrician, and throughout his career as not only a pediatrician and a medical director, he has remained an advocate for children's health issues. And as a former president of medical staff of 8 hospitals in Eastern Pennsylvania, he's worked with other leaders to promote children's health and health equity throughout different environments. He has also advised many regional and national committees and organizations, including the Joint Commission, American Academy of Pediatrics, and the American Hospital Association on Pediatric Issues. So I want you guys to please also welcome Dr. Jarret. Again, 2 experts that we're bringing to the show tonight to ask the question, is it safe for kids to go back to school? Now, if I could just, if also as people are joining the live tonight, please enter your comments in the feed. We're going to get to all your questions. We have some great questions lined up already from people who've already submitted. Hello, this is my folks in New York. Thank you so much for joining, Francine. We appreciate it. But again, this was a very important topic. COVID has taken us all by storm. We abruptly had to shut down the schools in March. It sent everybody on a tizzy, right? Parents, kids, we were just all at home on lockdown. And what did that do for our students? What did that do for our kids? What did it do for parents? And so some of what we want to get to tonight is can we set up our students, our parents, and our families for success? Whether you're going back into the classroom, whether it's going to be a hybrid model, or whether you're distance learning, let's talk about it. Again, we have some great physicians who are very knowledgeable, so please drop your questions in the feed and we will get to those. So, are y'all ready? Are we ready?
Ready.
We're going to take a closer look at this issue. Okay. So one of the things, and I want to say too, I'm a health provider and I'm a mom, and I'm a nursing faculty at a school. So I'm getting it from all different directions. People wanting to go back to school, afraid to go back to school, not sure if they can go back to school. So let me just ask the question, Dr. Sherri, do you feel like it's safe for kids to go back to school right now?
Well, Nurse Alice, I do not. I do not think it is safe to go back for the kids to go back to school. We know that there's we're hearing so many different discussions and commentary and opinions and facts about the likelihood of transmission from student to student, then student to family members. I'm in Georgia, and Georgia we peaked in March, and then we peaked again over the weekend. We had the highest rates again, and we had a great example of transmission at a summer camp. So it was about, I don't know if y'all have heard about this, but let me just tell you really quickly. It was 500 and so children and staff who had gone to an overnight camp, and everyone had to test COVID negative at the start to even be allowed to be at the camp. And within days, it was about 300 and so kids were tested and 260 were COVID positive, just that fast. And then there was an interview talking about one of the kids who had tested positive. His mom has lupus, and now both of them are quarantined. So one half are not in the house, are not quarantined, the other half are quarantined. We're just not ready to go back. We don't have the data to support that, and especially in our compromised communities, to have an outbreak, it could really be devastating, especially with all of the comorbid diseases in our community. So, Nurse Alice, no, we're not ready.
So thank you for that, Dr. Sherri. And for those of you who may not know, I looked at the latest stats. So let's see, 4,649,102 cases, over 154,000 deaths. A lot going on here. And some of, and a lot of this data that we're looking at is in adults.
Yeah.
What about our little people? Part of it is we're missing a lot of data because we shut the schools down. So we really don't know or have a lot of evidence as to what does the presentation look like in kids? Kids are pretty resilient. So there's actually some studies out of Korea and Italy that kids are asymptomatic in their presentation. And while they don't get sick as much, those that do get sick get really, really sick. Yeah. So I think that's something that we need to be concerned about. And again, this is just anecdotal information from other countries. We don't have enough science to back up what we're doing. And I'm worried because Dr. Sherri, what you described looks like a whole bunch of mess, a whole bunch of scariness, because I, as a parent, would not want to send my child into a program and processes and systems aren't in place. We're not sure how we're handling people, how are we testing, and there's no standard as far as what we're doing in each community, in each system. So, Dr. Jarret, let me ask you the question now. As a pediatrician, do you believe it's safe to send our kids back to school? I mean, what are you seeing in your practice?
I tell you this, Nurse Alice, I've been laboring over this discussion for weeks and weeks and weeks. People have been asking me this exact same question for the past month or two. And in a lot of cases, it's really too early to know. When I was talking about it maybe a month ago or 2 weeks ago, now, well, schools are opening in different parts of the country. Down south, they start to open early. We have evidence of a school district in Indiana just this week started up first classes in person. And well, before the end of the first day, that first kid tested positive in the school. So now the school systems are looking to figure out, well, what do we do? Do we go into our emergency plan right away?
Yeah.
Honestly, it just seems like it's too early for a lot of this. If we follow this out as we look at, what's been happening in pro sports, they try to get Major League Baseball going, and then it turns into 1 positive, turns into 10 positive, turns into postponing games. Yeah, so it quickly gets out of control. So I do too think it's still too early.
So one of the things that I've heard both of you say, and I'm going to theme this, is that we're just not ready. Part of it is we don't have enough data. We don't have the proper systems and resources in place. And let me say this, we know our school systems are underfunded already. Right? Many of them are already. And especially if you take those inner city schools, I mean, we're not going to get into the technology gap that happens with distance learning. A lot of things, just not prepared. I was actually speaking to some educators who said, you know what, Nurse Alice, our windows don't even open. You don't have good ventilation. What is this going to look like? Who's going to pay for this? Because many times teachers are digging in their own purses and pockets to pay for supplies for their kids. And that's not necessarily a knock on the school administrators, but it is. Because part of it is if we were to even think of doing this, what are the resources and are they working with health professionals like yourselves to get this in place, because this is very stressful. Like, I'm getting little palpitations right now because, and I'm seeing the comments coming in. Thank you for everyone who's participating. Yes, everyone's saying, we're not ready. Francine said, I'm not sending my grandson. It's not safe.
Right.
So many other people are having comments here that, let's see, Nancy said, that's why Canada's doing better than America. I think a lot of people are doing better than America right now, but that's a whole another thing. But Keisha said that the expectations of the parents to be effective and to figure it out exceeded that of the educators. Where is accountability? ? The support ? The data. Yes, no surveys were provided as to what the type of parenting supported was needed. LA Unified School District. So Keisha, I'm in Los Angeles as well. So I hear what you're saying, but parents are feeling left out, not knowing what to do. This is stressful, anxiety provoking. You take that and then you couple it on the insults from the depression and anxiety and all the other things that happen when we abruptly shut down the schools. Dr. Sherri, proms canceled, graduations canceled.
Yes.
The big thing, like, mama, I made it. So, I mean, what do we do for the emotional support and the well-being of parents and students who now find themselves possibly having to send their kids back to school? Or let's be honest, some school districts don't even know yet what they're going to do.
Right. Well, one thing I think we have to do is it's a family individual decision. Okay, so each family has to decide for themselves what is best. And I want to go back and hit something that you said, Nurse Alice. I think that one of the areas that I saw was that some parents shut down so that the modeling for their children about how to deal in a crisis didn't happen. Okay. And being aware of that is critical, because now there's got to be some recovery, and really some over recovery, to sort of go back and figure out, so what happened? This is what I was feeling. This is how child A and B and C, how many children you have, what happened? How are you feeling? Let's talk about symptoms, or not just feelings and thoughts, because children, lay people don't talk about symptoms. How do we cope? How did mom cope? How did dad cope? I apologize for not being the emotional support that you needed at the time, but moving forward, I am going to do better. And if parents are not coping well, you've got to get help. Okay, let me just say number one. Number two, I think with those proms that were missed, the graduations that were missed, I think children still could benefit from some type of pomp and circumstance. And unfortunately, I did see too little of that. So there was no prom. So there was no festivity around the prom. There was no graduation, per se. And I've seen parents and families where there was no dinner. There was no high school graduation. There was absolutely nothing. And so, yes, they will not have the typical fanfare and celebrations. We still have I'll say, responsibility to create those areas of normalcy for our children. Again, I sent Nurse Alice, I sent you some resources. Let me go on and tell people now. So a great place for resources to find referrals is Therapy for Black Girls. It's the largest national online site to find therapists in the country. Therapists, LPCs, licensed professional counselors, social workers, psychologists, psychiatrists. Another site for Black physicians is Health in the Hue. We also know that blackdoctors.org, because we know reaching out to people who are like us or like you increases the likelihood that you will be heard, and that we will be able to connect you with the resources that you need. So that's it. And then also physiologically, the basic things. When we think about Maslow's hierarchy, you got to make sure that everybody's sleeping well, making sure that we're eating well, and that we're getting hydrated and we're getting enough activity. So these are just basic things that we can do in addition to monitoring our mood, our feelings, and our thoughts. When we're at a point where we're not functioning at the level that we know we can, then we may want to seek some help. And you can always start parents with seeking help from your primary care physician.
Right. And I think, and it's okay to not be okay. It's okay to need help. And I am of the philosophy of you don't necessarily need to wait till something's wrong
Yes.
to fix it, because by that point, it's going to be an even longer haul to try to fix the underlying problem. So first off, mental health is very important. It's something that we should be constantly be taking care of, like we take care of our physical components every day. So Dr. Sherri, you brought up a lot of good points, and we put some of those resources in the queue, in the feed there. Now, so we talked a little bit about mental health, anxiety, and those type of things. Dr. Jarret, if I can swing the pendulum just a little bit, we know school is very important for academic development. There's definitely some things, as we shut down the school abruptly and we kind of went to this impromptu distance learning method, I think schools were all over the place. Some of these kids had the resources to try to do online work. Some didn't. They didn't have computers. They didn't have Wi-Fi. How class, it was a mess. It was a mess. And some of that not only impacted them academically, but there are also some developmental things that parents and family members should be aware of, that when our children aren't at school or engaged in that kind of organized activity, that it can impact, and correct me if I'm wrong, like social, cognitive, emotional, physical well-being. Can you elaborate on some of the things that can go, how it can negatively impact our kids when they are not in a school or organized program, or have the structure that school once provided for them?
You're absolutely right, Nurse Alice. Having a schedule is essential to a child's routine. In children, as they're developing from, pre-kindergarten age all the way through high school age, there's an expected routine of which a child should go through during a school year. And when COVID first came to this country, we had to abruptly stop what we were doing, which did not give the educators a chance to do what they needed to do and develop a plan, didn't give the parents to have a plan and develop a plan. And so things got all out of whack. And we realized, if we're going to be honest with ourselves, our children have lost, maybe close to half a year of schooling because the education, the process, the structure just wasn't effective because nobody had time to prepare. So I'm hopeful for what's coming in the fall that we'll be able to do better, because teachers, administrators, everybody had to plan for maybe a variety of different things that happen. But to get back to some of the damage that can happen with kids when they're not having a schedule, it just kind of affects their overall psyche. It affects their overall motivation. It can create anxiety. It can create some other unsettling feelings that they're not used to. So one of the things that I always did and came out early in this is just help parents have a schedule. In fact, I'll give this schedule to anybody who's listening today. If you want to have a COVID-19 kind of homeschool schedule so that you're able to just keep your kids on a schedule, because if you're able to keep your kids on a schedule, that will go a long way for their development and their sense of well-being. Simply just text COVID-19 plan, COVID 19 plan to 44222, and I'll send you the Dr. Jarret's COVID homeschool plan, because I've essentially laid it out with things that you can do for your kids at different times of the day, and try to just structure some normalcy to their life. And that's what one of the biggest things. It's just when it's abrupt, when it's chaotic, the kid will feel chaotic as well.
Here, can you say that again? You said text COVID-19 plan, all one word, all together?
Yes, all together. COVID-19 plan. COVID 19 PLAN to 44222, and I'll send that scheduled right directly to you.
Perfect. So we put that in the comments so you guys can share that with other people, because that's going to be important. Getting our kids back onto some type of schedule. And if I could just say, just have a transparent moment as a mother with boys, I've noticed that when we went abrupt with the schooling, I wasn't sure what to do, because as a healthcare professional, I was still working. So Lord help me out. I'll be honest, my kids were a little bit on autopilot, and
Yeah.
I was hoping that they were, doing their homework, when they're supposed to, but even there was lack of communication amongst students, teachers, parents. And so if you were like me, don't beat yourself up, because that's also another thing. I beat myself up for a long time feeling, oh my God, I failed my kids. But you know what? We had never been in a world pandemic. So forgive yourselves. You got some great experts on the live tonight. We're going to provide you some valuable resources, which we already have in the feed there. And we're going to try our best to provide you information so we can set you up for success. So let me shift a little bit to back kind of to COVID, because I think that every opportunity is an opportunity to educate around COVID-19, because we here on the live are health professionals. And we kind of had to, everybody around the world has had to learn infection control and some medical things that maybe, they're like, I don't want to hear any of this. This is too much. So what we're talking, and Dr. Jarret, let me just ping it back to you real quickly. Children and their presentation with COVID-19.
Yeah.
Is it any different from how adults present?
It can be, because in children, what we know about children is that they can actually be infected with the virus and not display any symptoms, or it can be a non-specific symptom, like maybe simply a headache, or it may be just some very mild cold symptoms that may be there. And so a lot of times people don't know that their kids may have that unless they have the history of the exposure. So there's a wide variety. So that's on the mild end. On the severe end, kids can also present with severe respiratory distress, severe cough, and we know this pediatric inflammatory syndrome that's like something we've known about for years called Kawasaki syndrome. But these kids tend to get very sick and can have some severe consequences regarding their heart and some other things as well. So yes, there's a wide range of how sick kids can get and the symptoms that they present with. But they can get severely ill, and we have had several reports of children who have died from COVID as well.
Yes. And so for those of you who might be just joining live, or for those of you who might need a gentle reminder, so when we're talking about COVID-19, although we said it's initially a respiratory issue, we're seeing a lot of other things. So in addition to headache, cough, fever, shortness of breath, fatigue, we're starting to see some GI issues, some diarrhea, constipation type of things. We're also seeing, what else are we seeing? We're seeing, people even develop blood clots in their lungs, into their legs, a lot of things, so it can, I say that to say those are some of the symptoms. We have a good share of people, almost 2/3, who are asymptomatic. But I think one of the most important things is that, guys, while you're out there, make sure you are wearing your mask,
Right.
Social distancing when possible, washing your hands with soap and water, or using hand sanitizer frequently, cleaning, sanitizing commonly used surfaces, and then avoiding touching your eyes, nose, and mouth, especially anywhere on your face.
Right.
Dr. Sherri.
I'm sorry, Nurse Alice, for cutting in. You're absolutely right.
Yeah.
Any kind of cloth face covering is exactly what people want. You want to wear this mask over your nose.
Yes.
You want to wear it over your mouth. You want to prevent those respiratory droplets from spreading. And it can be any kind of face covering. It can be a surgical mask. It can be a mask that you buy. You can actually make masks at home.
Yeah.
Any way you have these masks, heck, I don't care if you take this t-shirt and wrap it around your face, bandana, anything. The one thing that we do know about this illness is that a mask helps reduce the spread. So don't get confused on that one. That is one thing that we do know, and I wanted to just highlight that while you were talking about that, Nurse Alice. No,
I mean, you bring up some great some great information, and what we'll share later in the feed today is that if you are someone who, well, you should have a mask wherever you go, in your pocket, in your purse, in your car, with you at all times. Yeah. And sometimes we're in a rush. Sometimes we forget a couple of things. So just so people are aware, we also, as Nurse Alice, I have what's here called a travel kit, which I've actually do as a mother, as an ER nurse. I thought of y'all because, first off, I'm a mom and my kids forget all the time. Also, as an ER nurse, I think of what are the things that'll help keep you out of the emergency room.
Yeah.
And you don't have to buy a kit like this. You can put one together, but if you're inclined to, it's nurse approved. It has two masks in here, some hand sanitizer, 2 pairs of gloves, and some hand wipes. And it's in a case, and this sits in my car.
Yeah.
Car. Kids are gonna go stick it in their backpack, just like you prepare their lunch. Have something to go so they can, you can keep them safe at all times. And it's just one of those kind of emergency kits.
Yeah.
You can buy that at IamNurseApproved.com. We'll put it in the comments. But Dr. Sherri, all of this, masks, all of these frequent things that I have to do, it's gotta be very so stressful for people. I mean, I can just the idea of if I go out, I might get sick. Being around people. So although we are social distancing, could what's happening in our society today be contributing to we see more people with anxiety, more people with depression? Can the pressure of what's happening today exacerbate some maybe very mild mental health conditions that maybe we were just kind of managing?
Oh, absolutely. I've seen an increase in my patients with panic disorder. So they're already anxious, overly anxious, and by environmental stimuli, so things in their environment consciously cause them to feel anxious, or when we think consciously they're aware of, and also unconsciously they're not aware of. So increase in panic disorder symptoms. I think the first week of COVID, I think almost everyone had sleeping problems, and that's trouble getting to sleep, trouble staying asleep. Helplessness has been a big issue as well. Just really feeling helpless about the situation and just feeling overwhelmed. That initially it was okay. It's the newness. We were very fearful, and now sort of that honeymoon newness has worn off. It's like, okay, well, how long is this? So really, the rigor of it is wearing on people. And so, what I suggest is, and also obsessive compulsive symptoms. Symptoms and signs. So my patients who are already anxious about their health, about their bodies, are just sort of now hyper aware. They're overly aware to a cough and a sneeze and other symptoms. So I think it's just very important that we dial it back. So this is what I just say to my folks. You're going to have to dial back your expectations, dial back your activities so that you have the emotional room to adapt. It's also important that we're having those hard conversations with family members and friends that we are having, that's difficult. And this is not new. So pre-COVID, we may not be talking about some difficult things with our family. Now with COVID, we're still having trouble conversing about, are you going to wear a mask? I don't feel comfortable with you coming into my home because you're not wearing a mask. But again, these are symptomatic of what was already present. So it's time to address those barriers and those resistances to having those hard conversations. And the more we can set boundaries with our family members and friends, the more the anxiety goes down. I had a client today whose mother insisted that her son move out because he kept going in and out of the house. And she said, I cannot manage my anxiety with you going in and out of the house and you not wearing a mask. So the more the family does not commit to those precautions, the more the anxiety does go up.
Yes, and I can imagine that's also kind of heartbreaking, having to make a choice between, keeping someone like that in your home,
right,
versus I want to live, I want to be healthy.
Yes.
And our elderly, people with pre-existing conditions. And look, y'all, when we talk about pre-existing conditions, I think people think like they have a vision in their head of someone who's maybe frail or very sick. Heart disease, hypertension, diabetes,
asthma,
all of those things.
Yes.
And how prevalent is that in the Black community, the brown community? So I just want people to get out of their head that when we're talking about people with pre-existing conditions, that it's this old, frail person. No, it could be your cousin who is 27 with diabetes. It could be, your 18-year-old neighbor who has asthma, all of these things. So please, guys, it's very important. But let me ask Dr. Sherri, so we're talking with kids.
Yeah.
So as adults, let me back up. So as an adult, as parents, we try to shield and protect our kids from a lot of information.
Yeah.
We don't want them, watching too many graphic things that are violent, because we're trying to protect them. We have been thrusted into an era where we're seeing images. I'm just going to go ahead and, of social injustice. We're seeing COVID images of people in crowded emergency rooms, and they're talking, kids can hear sound bites of bodies in freezers as they're walking by flipping through the channels. What would be some signs that parents or educators might look for in our youth that might give us an indication that they're having some challenges with managing stress or anxiety or depression, and even though they might not vocalize it?
Well, some of it, I guess it also depends on if you know the child or not. So parents, your child, what they typically, their sleeping pattern, their eating pattern, how they interact with their siblings and you. So if that changes in a significant example, night terrors, and if there's new onset, if it hasn't happened before, you've got to be thinking about that. We know in terms of bedwetting can go, especially for boys, well past age 5. But if they've not had an issue really with bedwetting and that returns during that time, you need to be thinking about that. How does your family deal? How does your family utilize food as a way to deal with stress? Because we also know that eating disorders, overeating in African American girls continues to increase. So how much is your child eating? I mean, I have one of my cutie pies, and she's steadily gaining weight. And so I've had to really just be gentle with her, but also with her parents. I've noticed that such and such is gaining weight. I wonder how that's connected to her emotions. And also acting out behaviors that, I was reading something, and there was some siblings that were fighting, that how do our children regulate? And yes, horseplay will happen, but if it's excessive, if it becomes more aggressive, more violent, that is an issue. And also how our children are interacting with us. If the baseline functioning or baseline interaction is appropriate, and at some point it changes, then again, that's an indication. And what that change could look like is more talking back, being more oppositional, because sometimes a child may not feel like the parent has protected them, and they can be almost a leveling dynamic that's at play. I don't feel protected, so I don't trust you, I don't respect you, and so the opposition can then increase. So those are just some of the behaviors that could indicate that there's an issue.
Yes, and I'll listen. My son, he turned 17, football player. He wants to. He's very disappointed that there's no football season, and I've noticed he's a little snappier. Watch it. But he's a little snappier, and he's very upset. And then I've known he's like, well, why? How come it's like this? How come the governor said this? And so I also feel like while we're trying to manage some of those things, it's important to identify it and talk about it right then and there. But I'm also recognizing that language matters with how things are being said. So, like, for example, if I was on the phone with a girlfriend and I said, oh my gosh, we're never going to get to Bali because and the governor just shut down everything. Nobody wants us in their country. If I could be, as an adult, talking to my girlfriends about that, kids hear things.
Right.
So, little Johnny, who's 7 years old, might interpret that like, oh my God, I'm never missing my friends. And without really understanding the disease process or how COVID spreads and all those things, can develop some hatred, some anxiety. Like, he's going to hate the governor. He probably doesn't know. Well, I don't know if he knows who the governor is, but, blame the governor for all of this while not this. And like, oh my God, I'm never going to see my friends. This is the end of the world. So while you were saying that, I also wanted to piggyback to add there that language is important when we are around our kids, and just listen. Kids hear stuff. Even when you think you're whispering in the kitchen and having an argument, they hear you. They hear you through those walls. And so it's going to be important. So if you notice changes in behavior, like Dr. Sherri was saying, eating a little bit more, perhaps a little more irritated, all of these things, that might be signs that they need some help with coping with their feelings. And the first thing is to talk to them about it and then get them some help, like Dr. Sherri said. So, Dr. Jarret, you were smiling when I was saying all those things. I know you're as a father yourself and a pediatrician. When Dr. Sherri obviously painted the picture that their anxiety, emotions might be prompting people to eat. Are there any other things that might be going on during this time that we need to be on the lookout for that might present physically or exacerbate other physical conditions in children during COVID-19?
Well, one thing that I'd like to say as I think about kind of what goes on in my own household during this time is again, as both of you guys mentioned, how we react to these situations. Yeah. Because one thing that our children will learn is, and they must learn, is how to handle adversity. And surely, if COVID hasn't done anything else, it's teaching us how to handle adversity, how to handle ourselves in different ways. And so language is important, as you said, Nurse Alice. Yeah. Monitoring for signs of maybe being withdrawn or overly stimulated, too, are things to notice. But we need to show and demonstrate ourselves as parents how to handle these situations, because that is going to give the biggest lessons to our own children. And if we can do something that will help normalize some of the things that we're doing, because even with my less than 2-year-old grandson, he's able to put on a mask and wear a mask because, well, what have we done and what has his mother done? Make it seem normal. It's just a normal part of life right now. It's nothing to be totally afraid of. You need to understand how to wash your hands and do all the hygiene and stuff, but just try to make it seem as normal as it is, as long as they understand the risks that are involved and they can't live life normally as they would like to.
Right. And this is important. And I'm seeing some comments in the feed that are saying age-appropriate truthfulness. Yes, that's right, Keisha. That we need to be honest with our children. Yes, you're right. We do have to teach them that we have to be transparent. We have to be honest. Just as much as it's uncomfortable and uneasy for us, I think we as parents, as families, as community members, we can try to make it a little bit easier by talking our kids through this. I think it's when they go through the motions and nobody's explained what's happening. Right. That's where the anxiety and the frustration, it's like, why are we doing this? I don't know what's going on. I don't like this. And those emotions bubble up. Now, Dr. Jarret, I just wanted to piggyback on what you said. You talked about your grandson who's 2 years old who can put on a mask. So one thing I also wanted to mention on the slide, for anyone who's watching, please make sure you share this information. Everyone should wear a mask. Absolutely. I know there have been some people are trying to get waivers and all these things about masks. There are some scenarios in which wearing a mask, you might have to think twice, or there might have to be some extra supervision with wearing a mask. And that would be in children under the age of 2. Anyone who has maybe some mental or cognitive delays, who may not know when to take off their mask, anyone who has any physical dexterity or problems where they cannot take off their mask, or anyone who's unconscious, and people who use oxygen. So I just wanted to let you guys know that, that absolutely everyone should wear a mask, but there are some exceptions where there may be some people who, for a limited time, probably shouldn't wear them because it's more dangerous, or they need some help and supervision, constant supervision while they're wearing it. So important to know. Now, gosh, I feel like there's so much more we want to talk about. But there were some, let's see, some other things. There's so many things coming up in the comments there. But something I also wanted to mention, and I know we're talking about our youth and the children and parents, educators. We haven't forgotten about you. We love you. We support you too. You are equally as important. And the only reason why we probably didn't shout you out right away is because in my mind, if we can do things to protect the children, those will also protect our educators. And let me say, our educators are underpaid, undersupported. And if I had a bucket of money to give people raises, I definitely would. And I always am supporting my kids' teachers, giving in any way I can. So shout out to you guys. And I also want to know, also from Dr. Sherri and Dr. Jarret, you just chime on in. When it comes to, there are people we know are distance learning. Okay. There's a technology divide, but I think schools have had some time to prepare and get some things in place, right? For those people who are going back into the classrooms, or even doing a hybrid model where they're staggered. Either way, you're going back into a classroom with a teacher and kids. What should educators, parents, and students know, and what should they make sure are in place to safely do so?
One of the things that I think that they need to do and think about is, all right, well, now we've had a chance to do this, because if we're going to do virtual learning again, virtual learning will be better this fall than it was last spring, number one. Number two, our teachers have to be in a safe environment. And if they're going to be providing in-person instruction, then we need to make sure that we are following the CDC guidelines, because that's the best thing that we know. And that will include the face coverings, that will include trying to keep the distance apart, which is difficult in most schools. I know where my kids go to school, their class sizes are, 20s, 30s, and imagining getting 6 feet apart in between them in all these classrooms, that's just not going to be physically possible. So there's going to have to be some modifications that are going to be done in the schools to help make the environment safe for our educators as well. Because, well, as we're thinking about the spread of the virus, it really could be the educators that could be worse off and have more severe illness from catching COVID in the first place.
Right. And what we do know is, according to a July analysis by the Kaiser Family Foundation, about a quarter of U.S. teachers are at higher risk of severe illnesses from COVID-19, either due to their age or a pre-existing condition, such as COPD. And mind you, by the way, so for those that don't know, if you go to the CDC list to look for those pre-existing conditions, obesity, or excuse me, having a BMI of over 40% puts you at risk. So I know we might, we celebrate our curves and all that, but I want you to know, you may not have diabetes, you may not have hypertension or COPD, and you can call yourself slim thick all you want. But if your BMI is over 40%, I want you to understand and recognize that that is a pre-existing condition. And I'm only saying this because I love you and I want you to know. And part of the way we get through this and the way we get through this together is by coming together in forums like this and talking about those things, and allowing you guys to ask your questions. Dr. Sherri.
Yes.
We're going to have a lot of school administrators, educators, janitors, cafeteria folks, very kind of stressed out because kids, and let me say this. We said that COVID-19, most people are asymptomatic. So we think of coughing and sneezing. We look at someone and we know to back up. But if someone's asymptomatic, we don't really know. But kids touch everything.
Yes.
If you're asymptomatic child, you're going to be touching everything and spreading COVID. I know people, I know the administrators and everybody's stressed and afraid. How can they, let me say this, as a parent, I get frustrated. Sometimes my voice might go an octave up or two in that moment. How can we best prepare the people who are going to be working with our children to keep their feelings and emotions and stress in check so they don't inadvertently take it out on the kids? Because it's stressful time for everybody. I get it. And so when the stakes are high, the emotions high, sometimes that some might roll off your tongue.
Yeah.
I've done it because I've done it. So how do we prepare?
We all have.
I'm keeping it real. I catch myself like, okay, let me not.
Well, one thing, let me just say, my husband and his siblings and in-laws are educators. So we had a lot of conversation going on this side about that. And one thing that I would say is mask, and also I think teachers and janitors and cafeteria ladies and everyone has got to feel empowered to say what they need. So that means that I'm going to wear my mask, and I'm going to wear a face shield, and I'm going to, wear these additional pieces of protective garments. That I'm just going to have to do that. And because I think before the schools ended, there was some conversations about what was appropriate. But at this point, your life is on the line, and you're going to have to take a stand and say, if I'm having to do this, I will do this, and not wait on your administrator to give you permission if they say no. So it is what it is at this point. Another thing that I think could be helpful is there is a online program called OutSchool. I don't know if anyone has heard it, but it's OutSchool, and you can register for free. And it's for they have 15,000 different classes, and they have a very nice variety of emotional wellness and mindfulness programs. And so, and then over the last few years, there's been a big push to incorporate social emotional learning into the schools. And also there have been some yoga programs that some schools have implemented. So teachers, this is your time to put some have some focus time teaching your children how to regulate their emotions, especially as it relates to crisis and like Dr. Jarret said, adversity. I would not wait. I know you have XY things that you must accomplish during, for the semester, but your children being able to identify their thoughts and their feelings and connect those with appropriate behavior and be able to tell you when they're feeling out of control or escalating, that's going to help them, their peers, and you.
Yes.
But again, your school may not give you permission. You just have to make a decision that I know my kids can benefit from this, and I can too. And this is what I'm implementing for us.
Okay, Dr. Sherri, what is that? It's called OutSchool.
No, it's called OutSchool. OutSchool, and it's an online academy, and I wrote it down. They have classes for arts, coding and tech, English, health and wellness, arts, life skills. But they have a very nice section on emotional wellness, cognitive behavior, thinking areas for, it's age appropriate, teaching kids how to catastrophize and all that.
Okay, thank you for that. I put that in the chat box there so you guys can see that. Now, I want to say that there was some comments, and I think it was Keisha, I hope I'm getting it right, that said there's nothing that we can do to keep our kids safe in the classroom. What do you say to that?
Well, there are a few things. There are definitely a few things. It starts with teaching the basics, teaching the hand washing. Extremely important, even with your toddlers at home. This is the time to really hone in on hand washing, and not the kind where, I can think of my youngest son running in the house, running toward the refrigerator, wash your hands. He turns, drips some water over them, and runs back and goes do something else. Yeah. No, we're talking about, 20 seconds of scrubbing and getting the suds and the warm water, getting it in there. So hand washing is one thing. Two, the mask, I've said it before, having that mask is crucially important. And to some extent, once they go off into school, we hope that they will have, you're getting there, Sal. That's a funny
I'm trying to help y'all. I'm trying to help y'all some masks, some hand sanitizer, gloves, and the sandy wipes to wipe off your child's desk.
Yes.
All they need. It's right
Keep
there.
it in your car. Keep it in your car. Because like you said, people rush to do things. So you got hand sanitizer is important. Definitely got to have some of that on standby. Let's see, there was some. So I know we're going to be coming up. About 10 minutes left into the program. Dr. Sherri, is there anything that we haven't mentioned yet thus far that you really think are important to set our parents, our students, and our educators up for success?
Well, there are a couple more resources that I wanted to give about families who may be interested in homeschooling. There is a physician who's written a book called The Homeschool Alternative. and it says incorporating the homeschooling mindset for the benefit of Black children in America. And her name is Dr. Maisha Taylor, and she wrote the book with her daughter Haley Taylor Slitch, but her name is Maisha Taylor.
Okay.
There's also an African American homeschool mom group, African American homeschool mom group.
Okay.
And then there's another one called A to Z homeschooling.com, A to Z homeschooling.com.
Okay.
Because, and also so OutSchool has online curriculum, and also there's the Khan Academy, KHA.
That's a good one. I
Yeah.
do that all the time.
And it made me, well, let me back us up really quickly. Another thing that I've noticed in my patients here in Atlanta is that so many of my families don't have a village. And that's been the biggest issue, that they don't have a village. So they are families functioning in isolation. So it's a mom and children, or mom, dad, children, or mom, children, however the construct is, and they don't have the extension of other people. So when COVID hit, they had to come home from work, and then they had to teach children. There was really no one else to help supplement, to help support, to sort of dig in, because my children, my families with toddlers are the ones that are struggling the most, because you have a 3, 4, 5, 6-year-old who cannot, whose behavior, I mean, not behavior, but just very active. They're busy, and they're not attending to any type of lecture because they can't. And they don't, these families don't have other families that they can connect with. So I think during this time, we've got to recreate the village. And then that's for socialization for the parents and also the children, but also there could be a homeschooling pod where that if 6 or 7 families are all homeschooling, how come one parent can't take a day of teaching? How come another parent can't take a day, or either half days, so that one parent is not having to do it all? But it does require a connection and a commitment, and not networking, but just in connecting. And we've gotten out of that. We've lost the village. So COVID, you got to recreate your village in order to sustain and be healthy.
Right. So it really does take a village to raise a child. It takes
Absolutely.
people. And we can work smarter, not harder, working in tandem with one another, and rebuilding and recreating the relationships and the unity that we once had, and somehow we drifted away from that. Dr. Jarret, I'm going to go to you, but just real quickly, I've had some people asking about hand washing. How often should they wash their hands? So, you want to take that one?
Yes. Anytime your kid is out in any kind of environment outside of your home, coming in the home should be washing the hands immediately. Other times is going to be if they are using frequently touched objects, maybe doorknobs, cell phones and tablets, or other devices that can carry germs for a period of time. So you're also going to want to clean those things off as well. But as anytime your child leaves the house, when they're coming back in the house, they should be washing their hands. If you have to take your child to the store and you're masking up and you're going out to do those things, you may not have soap and water right there, but make sure you have that hand sanitizer. You see how small Nurse Alice's kit is. It can fit anywhere. So you can always have these supplies at any time.
There you go. Literally, you can stick this in your purse, in a backpack, glove compartments.
Yeah.
Not in your travel bag. And just real quick, I also wanted to say this. I know people are going to be going back to school. I really want to encourage educators, families, and students to advocate that, because high school, I don't know if y'all remember, but my high school bathrooms weren't always the cleanest. Didn't always have soap in there. Didn't always have running water. We need to make sure those things are in place. We need to have active ventilation. We need to make sure the classrooms provide for social distancing. I'm mentioning that because I'm seeing some questions in the chat box, and I didn't want to leave the live without saying that, you know what, our school system administrators, they really work for us. And I no shade to any educators, but really, so we need to be involved in our kids' lives. And whether you're grandma, whether you're the aunt, or you're the mother, we're invested in that young person in their future, not only academically, but physically, mentally, emotionally, cognitively. And you want to make sure if your kids are going to be going back to a community environment, that those things are in place. Ask them, what is your process and placement for a sick child? Who's getting tested? Are masks going to be provided? Do we need to provide our own masks? We do need time to prepare for these things. So educators, we haven't forgotten about you, but again, we're trying to help share some of the responsibilities. Making sure kids, or let me not say students, if you're watching this live, you do have a responsibility to make sure you ask for these things. Don't say, well, mom, they didn't give it to me. Well, I need you to speak up. So let's empower our children. Let's empower our family members. And then educators, we love you. You spend more time with our kids sometimes than we do. Right. You're like auntie and don't even know it. So we need to make sure that you guys are taken care of as well. Let's see if we have any other comments. There's been a lot. And thank you for everyone who's joined us. We really appreciate it. Dr. Sherri has been wonderful. Dr. Jarret has been wonderful. And let's see. So they're asking about, again, schools. They're thankful for the resources. Dr. Sherri, I'm going to put your resources in the feed. Some great stuff. So I'm hoping that you guys, please make sure that you take the time and you share it with someone else. And this is just the beginning conversation. So don't say, well, they didn't talk about this and they didn't talk about that. Boo, we just got started. This is a conversation that we should be having daily with our family, our friends, our kids, our educators, because our world's been rocked. So for us to get back on track, it's going to take a whole lot of discussion, collaboration, and a whole lot of effort and energy from everyone. So Dr. Sherri, before we wrap up the live, can you tell our viewers a little bit more about where people can find you, your services, and how to connect with you?
Okay, well, I can be found on Facebook and Instagram at Dr. Sherri Psych, and that's DrSherripsych, and I post probably about once a week. I'm trying to get better, but please feel free to follow me. And also, if you have a question, feel free to ask it, and I try to get back to you. I'm located in the Atlanta area, and with the COVID, what the medical boards have done to address COVID issues and in access, that depending on where you are, if you're interested in me seeing you for costs, then reach out to me, because before a physician had to have a license in every state, but because of COVID, they have relaxed. Many states have relaxed those requirements. So physicians are able to see people across the U.S. in many different states now. So I look forward to hearing from you.
Dr. Sherri, do you talk to families? Like, can you have a family session?
Oh, I love families.
You do it. Y'all, you better contact Dr. Sherri. You know it's hard to find a Black therapist. Come on now. I'm just trying to be real. And not saying that other therapists of other nationalities aren't helpful, but in today's society with COVID and social injustice, for our brown people, Black people, it's always helpful when we can find someone who we can kind of relate to the struggle.
Absolutely. Yes.
Okay. Dr. Jarret, tell the viewers a little bit more about where they can find you, your services, your books, and all that good stuff. Where can they go?
I want you guys to go find me at drjarret.com or across social media at Dr. Jarret. Spell out the word Dr. J-A, 2 R's, E, 1 T. Now, I especially want you guys to follow me on Facebook, because this is the discussion I've been having on my show, 2 Cents Tuesdays with Dr. Jarret, 1 p.m. Eastern every single Tuesday. I take questions from the audience. I take questions from the viewers. And we've been talking about COVID throughout this pandemic. And we've been really hammering in some of these things to be worried about in school. So make sure you check me out tomorrow, 1 p.m. on Facebook at Dr. Jarret.
Thank you so much. And you guys, I'm your host. And thank you so much for watching our first episode of The Exam Room with Nurse Alice, where we take a closer look at important topics that you want to talk about. You can find me on all social media platforms at Ask Nurse Alice. I do have a podcast on all your podcast platforms, Ask Nurse Alice, where I give you all the tea with no copay. I have a digital show you can check out my YouTube. And then again, if you were someone who's listening or you know someone, this would be, a great gift for someone. It's a travel kit designed with, not even COVID. And I'll say this, I had this in mind before COVID, the flu season. Just anytime we need to protect ourselves while we're traveling outside of the home, when you're not able to social distance, you're not by soap and water, you need hand sanitizer, or you see something yucky and you need some gloves, or you got to wipe down the surface. It's all here. It's refillable. Please check it out at IamNurseApproved.com. And this has been a delight. I'm glad we were able to have another conversation, meet you guys where you are in your homes. Yeah. Please share this live with your auntie, your uncle, your friends, your coworkers, your principals. Hello. Send it to your governor. Listen, I'm just trying to tell y'all, we're trying to get the message out. We just want, we are health professionals who want to see everyone living safe, healthy, and happy lives. And that's the bottom line. Aside from our products and services, that's really our goal, and that's why we're here. And I want to thank Dr. Sherri and Dr. Jarret so much for giving of their time. They're truly experts in the field. I really want to encourage you guys to follow them, to check out their books. Listen, Dr. Sherri, I'm trying to tell y'all, it's hard to find a Black therapist. You get a Black psychiatrist. Dr. Sherri's it, y'all. But this is an amazing time. If you have more questions, leave them on the feed. We'll still see them after the live, and we can go back and answer them. And stay tuned, guys. We're going to be doing this every Monday, 6 p.m., 9 p.m. Eastern Standard Time here on blackdoctor.org. We really appreciate you. Thank you so much for tuning in. And until next time, guys, I want to encourage everyone to live well. Bye.
Bye.